Hi everyone, I'm Priyanka Bharwani and today I have with me Dr. Divya Vora, a very renowned gynecologist and obstetrician. So Dr. Divya, tell us a little bit about yourself.
Hi, thank you so much for the very warm introduction. I'm Dr. Divya Vora. Like you said, I'm an obstetrician and gynecologist from Mumbai. I take a very keen interest in spreading information about women's health and awareness. And I have always felt that women need to feel themselves at all stages in their lives.
Oh, how nice.
So there's something known as functional gynecology, which I take very keen interest in, and a lot of people don't really know about.
So what is it about?
So functional gynecology is basically letting women feel the way they used to in their 20s and 30s, even after their 40s and 50s.
Oh, nice.
It's very upcoming, it's very new. It's something that a lot of people don't know about. But I feel that in our society, women are wired to feel like this is their course of life, and they're supposed to accept that they're aging sooner than everyone else, whether there's hair thinning or night sweats or feeling tired, exhausted, not wanting to do anything. All of this is normal and it's a course of life, but honestly, it shouldn't be.
So you help with reverse aging?
Yes, I very honestly, I'm very, very interested in that, and I would love for more women to know about
That's
it.
amazing. So talking about, how women should feel like they are 20 and 30 in their 40s and 50s. I am 40 and I would like to know a little bit about this whole buzz nowadays about perimenopause. What is it? Can you enlighten us a bit, doctor?
Very honestly, you don't look 40. That's amazing.
Thank you.
But yes, perimenopause is real, and many people don't talk about it because they feel कि menopause आ गया, okay, period बंद हो गया, and that's fine, that's part of life.
Right.
But perimenopause is basically the phase many years before menopause even arrives. And unfortunately, a lot of us don't know when it comes and when it goes. You know, we feel like it's going to be like a loud knock on the door, but it really isn't. चोर जैसे घुसता है वैसे ही पेरीमेनोपॉज भी आ जाता है.
So there are those slight symptoms that go unseen, but that's actually perimenopause.
Absolutely. So it essentially starts around the age of 38, late 30s in a woman's life, and goes on till the woman actually attains menopause. But honestly, I feel like it may start even postpartum because there's a lot of hormonal changes happening even after that. Right. So I believe, even though it's not textbook knowledge, but I believe that perimenopause starts as soon as postpartum. So what happens here is there is drop in our hormones, the major hormones like estrogen and progesterone that help us feel the way we do. It keeps our hair shiny, it keeps our skin lustrous, it keeps us energetic, it keeps our periods in sync, it keeps our moods in sync, and all of that. But as soon as these hormones start fluctuating, we feel a lot of symptoms. Now, these symptoms may include vaginal dryness, night sweats, hot flashes, and basically mood swings when you don't really understand why this is happening.
You don't know why you're feeling like that. Okay. We're 40 and I've spoken to so many friends who've lost interest in intimacy. Doctor, what is the cure for this?
So, honestly, I have spoken to so many friends and we're just in our early 30s and we all may be having the same issue too. So, honestly, this is only happening because of the drop in hormones. And since you said, what is the cure for this? I'd like to point out that this is not a disease. This is just a normal course of a woman's life where the hormonal fluctuation leads to decreased want of intimacy. Now, there are multiple ways we can take care of this. It'll sound very boring, I know, but the first is lifestyle management. When I say that, making sure we have a daily routine. Routine is boring, but it's essential. Sleeping on time, waking up on time, most important. Second, getting some amount of movement in every day, at least 20 to 30 minutes.
Exercise is important.
Exercise. Not only is it helping you feel better and releasing the happy hormone, but it's also taking care of your bone and joint health, which is very important in your late 40s. Thirdly, eating nutritious food, plates full of color, having balanced meals with protein, carbohydrates, fats, extremely important. And fourth, obviously, managing stress. Now, I know it's easier said than done, but there are multiple ways we can do that as well. And I know as women, it becomes very difficult to juggle everything.
Right.
So as of now, I've been taking mental health days, and I'm just saying I'm going to switch off for the next 4 hours where I read a book, listen to music, go for a walk. It always helps.
I think whatever helps everybody, right, to manage stress. What about magnesium? What is your opinion on that? Because I think lack of magnesium also leads to a lot of stress, which in turn leads to lower libido.
Absolutely. So in terms of magnesium, a lot of people don't get it tested when we get our regular blood test done every year.
Yeah.
And we just feel like, this is okay, I'm feeling tired, bahut kaam tha. But magnesium being low can actually affect a lot of factors.
Yes.
Like sleep and our body function.
Yes.
I personally have been taking magnesium for the last 2 years at night, and I feel like it really helps with my muscle soreness after workouts. It helps me sleep better, get 7 to 8 hours of rested, good sleep.
Yeah.
So, of course, while magnesium is one supplement, we also have our omega-3s, we have a vitamin D supplement, we have a vitamin B12, iron, calcium.
Important.
All of these are very important. And of course, getting yearly tests done of extreme importance.
Okay.
Other than this, would definitely recommend seeing your gynecologist at least once a year. So that you know your pelvic health and your entire body health is all right.
Of course. And what about vaginal dryness? I think you spoke something about that, which also leads to not wanting to have intimacy with your partner. So how do you think women can cure that?
Of course. So unfortunately, estrogen plays a very, very major role in our vaginal moisture and health. Now, as estrogen levels start going down after a particular age, we start experiencing vaginal dryness, a little bit of vaginal laxity, change in texture, and the pinkness and the good health of our vagina keeps reducing.
Yes.
Also, the natural lubrication of the vagina reduces. Our body's immunity reduces, which means the body's natural flora is not responding the way it used to.
Yeah.
And having recurrent infections and having discomfort while having intercourse becomes a major problem, after which women just don't want to do it anymore, and even the partner gets affected by it.
Of course, yeah.
First things first, I would tell my patients to start with using a lubricant jelly.
Right.
Now, if a lubricant jelly is not helping, of course, we need to look at the problem at a deeper level. And that will only be via examination and via understanding what the essential problem is.
Okay.
Now, if there are any nutrients to add, any supplements to add, any hormones to add, after a particular age, say 40, 45, we can add estrogen creams, which really helps moisturize the vagina and really helps with intimate health as well.
Oh, lovely. Okay.
Now we're speaking of PRPs. I'm not sure. Are you aware of something called PRP?
Vaginal PRPs?
Yes.
Oh my God, no, I'm not. What is that about?
Yes. So basically, PRPs are a way of taking cells from your own blood and injecting it into your
I've
body
heard of
again.
the scalp PRP.
We do
for
the
hair
same
growth.
thing.
So there's a vaginal PRP.
Yes.
To restore vaginal health.
Yes.
Okay.
Yes. So there's putting your own cells into your body and telling your body to regrow them. So your own cells in your vagina are regrowing and making your vagina healthier, pinker, more lubricated, and it improves sexual health in multiple ways. Having said that, it does not work if your lifestyle is not at pace with it.
So adequate rest, exercise, good food adds on to everything.
Absolutely. So like I said, correcting lifestyle is the first thing we do, after which we add supplements, after which we add some pelvic floor therapy, and then when you feel like it, you go in for things like PRPs, lasers, etc.
Lovely. That's so informative. So we spoke about vaginal dryness. I wanted to understand, how are washes, are they safe, or what is the cleansing process?
Oh God, the vaginal wash market is such a scam, very honestly. The vagina is a self-cleansing organ. Consider it like any tunnel or hole in your body, just like our nostrils, our ears. The vagina is similar. You don't need to put anything inside it to clean it. So vagina is a self-cleansing organ. All you need is a bit of lukewarm water and just dab it dry with a very soft cloth and you're good to go. Besides this, using cotton underwear, changing 2 to 3 times a day, changing your clothes after a workout, making sure you don't sweat, not shaving there too often, not using any moisturizers, creams with perfume, not using any chemicals out there. All of this helps.
Okay, amazing. Doctor, you spoke about infections. Let's talk about UTIs, because I know a lot of women face this recurrent UTI problem. So what do you have to say about that?
Can I tell you one thing? I feel like a lot of women feel very scared of using public washrooms and they hold their pee.
Yeah.
That is the biggest problem, very honestly, because when we're doing that, we're letting the bacteria that need to be flushed out stay in. So it's staying in your canal, it's staying in your bladder, and it's causing more infections.
Okay.
So what we basically need to do is first release the urine when it's formed and do not hold your pee when you go to public washrooms. That is more harmful than sitting on the toilet seat of public washrooms.
Oh, really? Okay.
So that's the first thing. Second, of course, is hydrating well. We need to hydrate a lot, make sure we're having enough water so all the toxins from the body get out.
Okay.
Now, why women are more prone to infections is because our urethra is very, very small compared to a man's. And the introduction of bacteria into that become very easy. Also, when we have intercourse, we have bacteria from our partner going in, which make the whole transfer into the bladder and all of that make it easier. Plus, aging worsens it because our natural flora and biomes are affected and our immunity goes down.
Right.
Like I said, everything is correlated, everything is interrelated, and also having vaginal dryness can lead to microcuts, friction, along with shaving. All of these are major factors that may lead to UTIs.
UTIs are a part of every woman's misery. How can we stay hygienic to avoid this?
First of all, let's not be miserable. I feel so bad that all of us need to keep feeling miserable about everything going on with us. But yes, this is very essential yet simple. So firstly, because we're living in India, we need to wear cotton underwear. Please, everybody ditch the polyester, ditch those G-strings and thongs. Please, it just doesn't work. And, we need breathable material. So that is the first thing. Changing at least 2 to 3 times a day, very essential. Secondly, after an exercise, after sweating, being outdoors, come home and change, very important. Thirdly, wash the area well with just lukewarm water and then dab it dry with cotton. Make sure while cleaning, we clean from front to back and never back to front. So we don't want the bacteria coming from back to front. That worsens it.
Okay.
Fourthly, shaving, waxing, all of this causes a lot of irritation, discomfort, which eventually increases the chances of us getting infections. So try and avoid that as much as possible.
What about laser, doctor?
I am totally for laser
That's
hair
better,
reduction.
right? It's just a one-time thing and you're done. I mean,
Absolutely.
6-7 times and you're done.
Yes, there are sessions, and if it's working on your hair, please, of course, consult a dermatologist, get everything ready before, you should be going in for something like this or not. But it does work on coarse hair.
Yeah.
And I
to
personally
maintain a little hygiene.
Yes.
Yes. And
Absolutely.
what about liners? Do you recommend that?
Yes, I do.
The liners, to sort of maintain it and keep it dry and not moist to increase bacteria.
I fully agree. So not all the time, but I feel like when you're out of the house.
When you're out for long hours and you can't change.
Yes, absolutely.
Okay. Perfect.
And also very important, please pee after having intercourse. This is something that people don't
I've read that a lot.
Yeah, they have intercourse and then go to sleep. It's not that it's a dirty act or, it's unhygienic. It's just that there are certain amount of bacteria out there. You may have used a lubricant. There's a lot of movement going on. Just peeing, washing off the toxins and cleaning the area and dabbing it dry really helps and reduces the chances. And hydrating, extremely important.
Those are some amazing tips for all women out there, doctor. Thank you so much. So, doctor, you are 15 months postpartum. Did you go through any postpartum blues? And can you help us how husbands can deal with this better?
Thank you for this question, Priyanka. It feels like very personal. But although I know so much in theory about postpartum depression and I've seen patients go through it day in and day out, when I felt it myself, I feel like I did have postpartum blues and I understood it sooner than anyone else would. Unfortunately, in our country and in many other countries, mental health is not given as much importance. And when it comes to a woman's health, it's one of the most essential things for us to keep going.
Yes.
Because our hormonal fluctuations actually are maneuvering our mental health as well. So postpartum, we have this sudden crash in hormones like estrogen and progesterone, and prolactin is so high. All of this makes us feel very low, lonely,
depressed.
We're literally sitting with the baby, breastfeeding, there's no one around, in pain, bleeding, all of that, and feeling like everyone else's life is going on and ours
yours
has
is stuck.
Just
Oh my God, I've been through the same thing. And they have this Indian mentality, or maybe, I don't know, elsewhere also is such ke, Are bacha hua hai, abhi to you should be happy. Why are you crying? And I used to have these outbursts, I used to start crying suddenly and everybody around was like, but why are you crying? So this is what, doctor, I'm sure every woman goes through it at some point.
Absolutely.
Maybe some go through it for a month, some 6 months. So how do you think we can educate the men to support the women better?
Of course. So like I said, educating men about what we're going through with our hormones. Fortunately, my husband's a doctor as well, and he understood what I was going through in terms of my hormones. But when it came to telling the entire family that, you know, I don't feel good and I'm crying, but I don't know why. You know, it becomes difficult for families and families to understand, because we live in a society where women have birthed 5 to 6 children and they're like, हमने तो कर लिया था.
They're just expected to feel good. They're expected to do things the way it's been done always.
Of course, childbirth is beautiful. Of course, having a child, breastfeeding, all of that is beautiful, brings happiness. But you may not be feeling happy at that time for many reasons, and that's absolutely okay. We need to normalize feeling sad, having blues, and not feeling yourself after having a baby. You can't essentially be happy all the time. It's not possible.
Yeah.
And that's when I'd really request all the husbands and men to just step in. If you're not being able to help with the baby, do what you can for your wife. Do what you can for your partner. Bring her a glass of water when she's feeding.
Yes, yeah.
Make sure she's having her meals on time. Get her favorite desserts and chocolates. Please, desserts, chocolates, खा सकते हैं वो first 40 days maybe.
Oh, really?
You can do that. Absolutely. Get her favorite food. Give her a foot massage. Give her a back massage. Please give her a shoulder massage.
Yeah.
They're always hurting.
Oh my God,
feeding.
yeah, holding the baby, right?
Absolutely. And take over night feedings for the baby if possible. Give a bottle feed at night if you can.
Right.
Wake up with her if it's possible. And even if you're not waking up, take over in the morning. There's a lot you can do, not just to help with the child, but to help your partner and your wife feel better in that phase of her life. She's not only lost her old self, but she's also doing so much more to bring up a very tiny human that she herself is seeing for the first time in her life.
And you don't care for yourself anymore because you're caring for a tiny human.
Yeah, so book her a spa, book her a massage and spa, for sure.
But thank you, doctor. I think this session was so informative for all women, new moms, to-be moms, and even women in their 40s who are going through a lot due to perimenopause.
Absolutely.
Thank you so much for being here.
Thank you so much, Priyanka, for having me. It was lovely being here. I'm glad you're breaking stereotypes and having these conversations and realizing that it's not okay to feel the way you are at 40. You need to feel like you're 20.
100%.
And there are ways to take care of that.
Amazing. Thank you.
Thank you.